Hello, everybody. I am Femi OK. Welcome. Good morning, good afternoon, good evening. Welcome to Power the Partnership, End the Neglect. So what are you tuning in for? What are you tuning into? Well, you are tuning into a celebration. We are celebrating the successes of the London Declaration. You are tuning into a rally linking the NTDs with the SDGs. They certainly go together. What is possible when we do both of those together? And then you're also tuning into a call to action. What is possible in the next decade? So for the next 2 hours, you will need some tools. I have already seen you in the chat room. I said hi to you in the chat room. You can talk to each other around the world and communicate with each other. Ask the question box is the box that I am particularly interested in. Put your comments in there, put your questions in there, and I will wrap them into a big global conversation that we're also having. A couple of hashtags, end the neglect, beat NTDs. I've been looking out for you on Twitter there as well. And one more thing for me to do before we get started, and that is to say hello to your co-host and my co-host, because this conversation is going to go both ways. And Henry Bonsu will tell you how you too can be part of today's event. Henry.
Thank you very much indeed, Femi. Good to see you. Now, yes, throughout the broadcast, we'll be offering you quiz questions, a few polls, and a chance to chat. If you would like to watch this broadcast with a French translation en français, then click on the English button at the bottom of the video and select French from the drop-down menu. A quiz or poll question such as, be honest, are you watching this virtual event whilst eating your lunch? A question like that will appear top right of your screen. You just have to pick one of the three options below. Yes, no, sorry, what was that? I spilt my soup. It's very easy. So the first question, since the London Declaration on NTDs in 2012, how many fewer people require treatment for NTDs? 25 million, 350 million, or 500 million? I'll give you the answer later, but for now, back to you in Washington, dear Femi.
Thank you so much, Henry. So our keynote address is going to be done by a politician and a humanitarian is really well known for her commitment to women and girls. Why is that important? Well, because NTDs disproportionately impact women and girls. So we wanted to make sure that we kicked off this event with somebody who truly understood the issues. So please welcome the Right Honourable Helen Clark, PMNCH Board Chair, and of course the former Prime Minister of New Zealand.
Thank you, Uniting to Combat NTDs, for inviting me to be part of this important conversation today. So much has been achieved since the 2012 London Declaration on neglected tropical diseases. 1 billion people have received preventive treatment 4 years in a row for at least one neglected tropical disease. And 32 countries have eliminated at least one of the 10 NTDs named in the London Declaration. There are now fewer than 1,000 cases of sleeping sickness anywhere in our world. Succeeding in the fight against NTDs helps us achieve other health goals too. Training health workers to provide high-quality treatment, conducting novel disease surveillance, and enabling referrals to functional local health facilities all helps strengthen health systems and advances the causes of universal health coverage and of primary health care. As well, meeting the NTD targets helps us achieve the Sustainable Development Goals. NTDs are specified in Sustainable Development Goal 3, but addressing them will also boost progress on other goals, including those on reducing poverty and hunger and lifting educational access and achievement. While we can look back on progress on the NTDs over the last 8 years with pride, we do need to do much more. Some of the targets in the first WHO roadmap won't be met at current rates of progress. And that would mean, for example, that 44 million children in the Philippines are at risk of parasitic worms. Women and girls do suffer greatly from NTDs, from poor fetal development, maternal anemia and mortality, pregnancy complications, infant mortality, and low birth weight. 1 in 3 pregnant women in endemic countries is thought to be infected with hookworm. Trachoma, the leading cause of infectious blindness worldwide, disproportionately affects women, children, and adolescents. And as ever, it's girls who are usually expected to drop out of school to take care of sick family members, with lasting impacts on their job prospects and economic independence. Now, the COVID-19 pandemic threatens both health gains already made and future progress. So, how can we ensure that no one is left behind? In a word, through partnership. That's the guiding principle behind the SDGs, and it is the core mandate of the Partnership for Maternal, Newborn and Child Health, which I chair, and which brings together more than 1,000 organisations. The NTD community is a great example of international solidarity, with its continual innovation, the leadership of its partners, and the record-breaking drug donation program of pharmaceutical companies. Now, as the WHO develops a new NTD roadmap taking us through to 2030, we must come together with renewed determination and commitment to focus on vulnerable communities and to provide more financial support and tools for more effective prevention, diagnosis, and treatment. Do we have what it takes? Yes, we do, but only if we work together. We can't afford any delay if we are to eliminate these diseases once and for all.
Thank you, Helen. Did you see what she did there? She linked the NTDs with the ripple effect that happens when you solve, when you eradicate, when you control those NTDs. I want to give you a progress report on what's been happening, the major achievements since the London Declaration. That was in 2012. But before I do that, I just have to say hello to Professor B. Nazir Ahmed. He's a former director in disease control in Bangladesh. And this is what he has to say about the London Declaration. I highly appreciate the London NTD Declaration because of the impact it had on Bangladesh. Let's see what the London Declaration's impact has been in other places around the world. Let's take a look.
2012 marked a landmark moment in the fight against neglected tropical diseases. We came together as partners to improve the lives of over 1.7 billion people. We pledged to control, eradicate or eliminate 10 NTDs by 2020, and we made huge progress. These are our top 5 achievements.
Since the London Declaration was signed, over 12 billion treatments worth more than $17 billion have been donated and delivered to the world's most vulnerable people to help defeat neglected tropical diseases.
In January 2017, a new Guinness World Record was set for the most medicines ever delivered in a 24-hour period. In just one day, over 200 million medicines were delivered.
Lero lino anthu opitilira 500 miliyoni pa dziko lonse lapansi sakufunikanso kumwa mankhwala a NTD amene ali antchecha ndi likodzo. Ndipo ine ndine mmodzi wa iwo amene ndinamwapo mankhwalawa ndimatha kusamalira banja langa kugwira ntchito zanga bwinobwino.
Since the London Declaration on Neglected Tropical Diseases, 32 countries have successfully eliminated at least one NTD. I am proud that my country, Ghana, is one of them.
Finally, the most vulnerable people on the planet are being heard. The world is learning about the huge impact that NTDs have on so many lives. And they are now firmly on that global agenda, written into the Sustainable Development Goals. So what will the next 10 years be?
Thank you so much to the partners, the stakeholders, the original partners of the London Declaration, the new partners yet to sign on board. But we really thank you so much for all the amazing work that you did in just 8 years. Henry.
Yes, that powerful film also gave us the answer, Femi, to the first quiz question, the brilliant news that more than 500 million people no longer need treatment for NTDs.
The amazing thing about this, Henry, is that it's actually really easy. This is low-hanging fruit. It's not even low-hanging fruit. It's melons and strawberries. You know, melons and strawberries grow on the ground. It's so easy. It's so easy in terms of how much does it cost? How much do the pharmaceuticals cost? We'll find out a little bit later that this is very achievable, eliminating, eradicating, controlling NTDs. Henry, I know that you went off on assignment and you were looking at the successes, those success stories that we've seen over the last 8 years. Where are you going to take us?
Well, I'm still struggling to get the idea of melons and strawberries out of my mind, but I'm going to try and banish those. Because yes, absolutely, there is much to be done. I've been on assignment and I've been asking questions. I want to ask this quiz question though. How many continents are affected by NTDs? 3, 6, or 7? Do you know, Femi?
Am I allowed to play? Can I play?
No, you're not.
All right. I know. I'll type it into the chat later for you.
You're not allowed. You're going beyond your kind of ken here. Well, listen, I'm going to try and work out. I'm examining what can be learned from those 8 years and what success looks like in different countries. I've been speaking to health leaders and practitioners across the globe. I started in Nigeria, and earlier on today, I spoke to the Health Commissioner of Cross River State, Dr. Betta Edu, and asked her what have been the big wins on NTDs.
Thank you so much. So basically, Cross River State has been able to eliminate some of the neglected tropical diseases that are of public health importance to us. And of course, we have just about 4 left. We have been able to buy over the consciousness of communities that have high burden of these diseases to work with government and work with other key stakeholders to eliminate them. And we believe that working together with the communities, religious leaders, and all the gatekeepers, we would eliminate the 4 NTDs that are of public health significance to us as soon as possible. So these have been some of our great wins, ability to work closely with communities to achieve lots of.
And when it comes to those 4 remaining NTDs, what, Dr. Edu, in your opinion, can the NTD community do to work more effectively and deliberately with the WASH sector toward achieving the 2030 goals set out by the WHO roadmap?
Basically, the most effective way would be to encourage intersectoral collaboration. We would want to be able to use the inroads from the WASH program to see that we can address NTDs in communities that have very high burden of disease, bearing in mind the fact that the WASH program has been able to gain the attention of community leaders. We have community members and we have a structure right from the World Development Committee up until the state level, where we are working to improve on sanitation, health, availability of water, and other things as concerns the WASH program. So we want to build on that structure to bring more and more care for people who might be exposed to NTDs, and also ensure that the community can handle both programs as the same. Remember that we would have mutual gains for both the NTDs and the WASH program if we have that integration, not just the NTDs and WASH program, but several other programs in the health sector. If the integration is solidly done with proper coordination from the Cross River State Ministry of Health, we would get better results on eliminating NTDs in our state.
Thank you very much to Dr. Betta Edu of Cross River State. So integration is the key to success in Nigeria. Let's travel now 17,572 kilometers to Vanuatu in the South Pacific Ocean. The country is an archipelago of over 80 small islands with a population of around 300,000 people. With me is Vanuatu's Director of Policy, Planning and Corporate Services in the Ministry of Health, Dr. Samuel Pozikai Tapu. Now, Director, what have been your big wins in NTDs?
Thank you, Henry. So in Vanuatu, as you have rightly mentioned, we, under the neglected tropical disease, we have a unit specifically under the ministry that looks after 4 of the main diseases. And we have, in our achievement, we have eliminated three of the main ones, and that's elephantitis, dossier for trachoma now prepared, and filariasis. So in our time spent with the ministry, we have actually done them with the help of other sectors, as most of our services in the NTD unit has been decentralized down to the provinces and basically down to the rural remote communities.
And what have been the key factors for success in the NTD program?
Yes, so Henry, I think the main success is that I commend the political will behind it, the elimination of the programs, and also the financial support that we have received from WHO, and also the community participation and the involvement of the communities, especially the chiefs in the respective villages, and also the communities that have participated in assisting our health teams deliver the services down in the very remote islands in our country.
So in Vanuatu, political will, WHO finance, communities and village chiefs have worked together. Guyana is in the Amazon rainforest and shares its borders with Brazil. Public Health Minister Dr. Volder Lawrence, what have been the big wins in Guyana?
Among our big wins are leprosy elimination as a public health problem, which was achieved at the national level as per the 1991 resolution of the World Health Assembly. Secondly, our efforts to eliminate lymphatic filariasis over the last 3 years. We have been able, through mass drug administration, to achieve over 85% epidemiological coverage. Further, Guyana has been the first country in this hemisphere to adopt the triple drug strategy: ivermectin, DEC, and albendazole, and is on the last mile to elimination in 2020. And lastly, we have integrated deworming in our routine health services for our pregnant women and children.
Great to hear the progress you're making there, but obviously everybody needs clean and safe water. So, Dr. Lawrence, which plans are in place to ensure this happens?
Guyana has strongly promoted clean and safe water, good hygiene practices, and safe solid waste disposal. Over 80% of our health facilities have access to running water. Given our demographic geographically, a multi-sectoral approach was developed by the Ministry of Public Health in collaboration with the Ministry of Communities. We have partnered to bring potable water to our remote communities by digging several wells and promoting the construction of VIPs. With the onset of COVID-19, we have extended WASH in all communities across the country.
Thanks for that, Dr. Lawrence. Well, countries around the world are coming together with a range of pharmaceutical companies to tackle some NTDs head on. A fine example is Novartis and their work on leprosy.
Leprosy is one of the oldest diseases known to man. For the past 3 decades, Novartis and the Novartis Foundation have been working with global partners to make it history.
When you think about what we've been able to accomplish in the last 30 years, we've been able to eliminate 99% of leprosy cases. And I believe with the combination of the diagnostics we have and the medicines that we have in hand, we could create a leprosy-free world.
Core to reducing leprosy has been the widespread availability of free multi-drug therapy, donated by Novartis and administered in partnership with the World Health Organization, WHO. But it's time to up the game.
We see that today there is still 200 to 250,000 new leprosy patients diagnosed per year, and that is too many.
To really wave goodbye to this neurological disease forever, the Novartis Foundation has been a driving force in founding the new Global Partnership for Zero Leprosy, launched at the beginning of 2018.
You know, one thing as Novartis we've learned through our work in a range of different tropical diseases is that you can't succeed alone. And you need to have partnerships across all sectors.
The partnership's vision is zero leprosy. No disease, no disability, and no discrimination. Its purpose is to facilitate alignment of the leprosy community and to accelerate action toward the goal of zero leprosy.
I'm quite excited about the power of app-based technologies to help us better address the leprosy challenge. One is diagnosis and being able to come up with more sophisticated ways to diagnose. And the second is to track where those cases are geographically so that we can treat better.
Treating better is understanding that the areas where new leprosy cases are still appearing and where many of the 2 to 3 million people with leprosy live are in hard-to-reach areas where stigma around the disease is rife.
Digital health will revolutionize, will reimagine the way we can deliver services to leprosy patients. We can make the leprosy diagnosis available at the mobile phone fingertips of a patient, him or herself, by sending an image of a skin lesion to the cloud and getting a probability back of what is the chance that this is leprosy. And with that, cross the barrier to seeking healthcare.
We have the opportunity to use the modern tools of tomorrow to tackle one of the great ancient scourges of humanity.
Novartis and the Novartis Foundation won't give up. We want to make this disease history.
So let's salute the incredible progress from all quarters, but how can programs contribute to the SDGs, ensuring no one gets left behind? And can they make communities more resilient to diseases like COVID-19 and the various crises? Over to you, Femi.
Thanks very much, Henry. Those questions will be answered by the two doctors that are going to be joining us. If you have questions as well about NTDs, anything, you can ask our doctors anything for about the next 8 minutes. So jump into the Ask a Question little box. We will be looking at it and those questions will come through to me. Hello, Dr. Julie Jacobson, and hello, Dr. Maria Rebolo. Nice to see both of you. Welcome.
Nice to be here. Thank you, Femi.
So Dr. Maria, first of all, tell everybody what you do, your official title, so they understand what kind of work that you do.
Yeah, my name is Dr. Maria Rebollo, and I lead the ESPEN project in AFRO, that is the Preventive Chemotherapy Department for the AFRO region.
Great to have you. Dr. Julie as well, explain your title, what you do, so people understand exactly where you're coming from too.
I'm Dr. Julie Jacobson, and I am the managing partner of a nonprofit called Bridges to Development. And I've been working with the London Declaration and this partnership since the very start.
So, Dr. Julie and Dr. Maria, one of the questions that Henry posed, and it was quite a hard one, and that was the idea of the NTD programs contributing to the SDGs. Maria, your take first of all.
Well, in the African region, there has been a massive contribution because, you know, just if you think about the health coverage that is happening in Africa due to the NTD programs, over the past 8 years ago, there were not even mapping having been completed for the preventive chemotherapy diseases. And now we have been able to really reach all the countries in Africa and complete mapping for LF, Schisto, and STH, with only a few remaining gaps for trachoma in 6 countries in the continent. And this is contributing massively to reach the SDG 3. You think also in the treatment coverage. 8 years ago, before the London Declaration, less than 200 million people were being reached with treatment, and now we have been able to duplicate those numbers. 450 million people are actually being reached annually in the African region with preventive chemotherapy medicines, and that is really a massive improvement. And ESPEN is actually playing a critical role because we are being able to fill gaps in over 26 countries in the continent, being able to reach full coverage.
And Dr. Julia, this connection with the SDGs is really important. I want to ask you this question. This has come from one of our attendees. Thank you for putting your Ask a Question in. Does fighting NTDs with environmental interventions such as WASH also help to combat climate vulnerabilities? That's a hard question. It's a big one. Dr. Julia, what do you think?
Yeah, I think that working across sectors and working in partnership with communities creates a resilience that's going to help us for when it comes to climate change, when it comes into pandemic response, all of these pieces. So I think the cross-sector linkings are going to be extremely important for being successful in achieving the goals from the original roadmap, and even more so in the new roadmap from WHO. So these cross-sector linkings, WASH is absolutely essential. And by doing that, we create more resilient communities and stronger partnerships with communities in order to be able to overcome many challenges, including climate change.
The questions are flowing in, doctors. Let me give another one to you. Dr. Maria, you take this one. As a One Health advocate, I would like to ask whether this forum understands and pushes for the eradication of NTDs by using a One Health approach. Maria, can you handle that one?
Yeah, absolutely. I think actually now with the COVID-19, we are learning a lot of lessons, because if you think, COVID is being terrible and is representing a terrible risk in the African region as well. No, 5,000 people have been already taken their lives because of COVID-19, and the numbers could be even much higher in the near next months. But we cannot forget that neglected tropical diseases also can kill up to 200,000 people in the continent when they are left untreated and unattended. And the good lessons that we are learning is that the program managers in the African countries are reporting that the NTD program managers and the community health workers are really playing a critical role in the fight against COVID. What is demonstrated this One Health approach. 73% of the countries have reported to us that the community health workers are being in the front line in the fight against COVID, working in things like health education, WASH, contact tracking, and being able to integrate measures. Therefore, we have been able to demonstrate that we don't have to compromise, that we don't have to prioritize one disease and neglect the others, that it is possible by integrating measures. Africa has demonstrated that it is possible to win the fight against COVID, NTDs, and many other health threats.
Welcome to Ask Our Doctors Anything. You haven't been able to stump them yet. Dr. Julie Jacobson, just remind everybody who you are.
Dr. Julie Jacobson. I'm the managing partner of a nonprofit called Bridges to Development, and have been with the Uniting to Combat NTDs since the very begining.
All right, very good. And Dr. Maria Rebello is also one of our Ask Our Doctors Anything. Dr. Maria Rebello, remind everybody who you are.
I work for WHO, and I lead in the Afro region. I lead the PC-NTD department that is called the Expanded Special Project for Elimination of Neglected Tropical Diseases, ESPEN.
This is why I asked you to remind everybody, so I didn't have to say all of that, but thank you so much for being here. All right, so this is a great question for both of you. How can GIS data and novel technologies be helpful to curb NTDs? Julie, you start.
This is a perfect Maria question, actually.
Oh, all right. Maria, you start.
Thank you, Julie. Well, actually, we know we really strongly believe in data in the Afro region. We really believe that for eliminating diseases, GIS and real data that we can be very how we say, exact and real-time data is super important in the fight against diseases. So we have created a portal online in Afro that is called the ESPEN portal that currently is hosting site-level information and individual-level information with full detail for all the 5 preventive chemotherapy diseases. And Afro has now made the decision to integrate in this portal WASH indicator, malaria indicators, HIV indicators, and even, hopefully, even COVID indicators, because we believe that GIS is fundamental, and being able to see the epidemiology of the disease, being able to track the progress is going to help us massively as we move towards elimination of these diseases.
So that question was from Emmanuel Ona. Thank you, Emmanuel. Good question. All right. Considering the impact of the COVID-19 pandemic in NTD control programs, how can these programs adapt? Dr. Julie, are you going to take that one?
I certainly will.
All right, go ahead.
I think the big piece for us in light of COVID is the building on the trust the community programs have pulled together in fighting NTDs. So because the communities are an essential piece, they're an element of, they are where the programs happen, they're where the programs are happening for, with, and about. It's created a huge amount of trust within communities. And I think that's going to be a very essential element for us overcoming COVID. There's been so much misinformation. There's been a big betrayal of trust, I think, in some of the responses that have happened, but building off of the strength of the NTD response and the strong community relationships, we can build back that trust and use that trust to help solve and overcome the battle against COVID as well. And I think that this is also a key piece. Another thing for keeping us on track is the partnerships, and this very, very strong, which is the theme, of course, of this whole event, is the very strong partnerships that we have with multiple different organizations around the world, and each with very special relationships in the countries and within the countries and the communities and the people that they work with, from the global level right down to the very individual level. And so building off of those relationships and the strengths and the resources that all of the partners bring to the table will be part of that success.
Dr. Julie, Dr. Maria, let's put them up together. These two giant brains as far as NTDs are concerned. Thank you for playing Ask Our Doctors Anything. Thank you, audience. Excellent questions. Keep them coming. Really appreciate you. And now, back to Henry.
Thank you very much, Femi. How on earth do I follow that? Those three big brains, not just the two doctors, you too, Femi, and the energy. I hope the people out there, all our viewers around the world, feel as engaged as I do here. Now, earlier this week, we learnt of the tragic death of Dr. Ricardo Thompson, who dedicated his life to the health and well-being of others. To pay tribute to Ricardo, here is the Minister of Health, Republic of Mozambique, His Excellency, Professor Armindo Tiago.
Dear colleagues, we lost our dear friend and collaborator, Ricardo Thompson. Our sadness is deep. The Mozambican scientific and public health communities mourn Ricardo's premature departure. For the last 30 years, Ricardo played key roles in the development of the Mozambican health research system, including as serving as a scientific director for our National Health Institute during more than 8 years. As both a multidimensional human being and a talented scientist, he made important contributions in research and public health in a variety of subjects, including neglected tropical diseases, malaria, HIV/AIDS, and health systems. Ricardo believed that health and well-being for all could only be achieved through evidence-informed policies, collaborative governance, and fair international cooperation. He served on numerous international public health bodies and committees, where he also represented the voice of his country and that of the African continent. We lost a colleague, a friend, and a mentor. We lost an enthusiastic, creative, and tireless public health scientist. However, for a period of 3 decades, we were blessed with his knowledge. We were privileged with companion and love discussions. We did achieve joint accomplishments. And these goods and these memories and understanding achievements, we will all stay forever. Thank you for your attention.
And Ricardo's legacy will be the continued combating of NTDs, diseases that the whole world will need to work together to eliminate. Now to the question that I asked earlier, it was this: how many continents are affected by NTDs? 3, 6, or 7? The answer is 6, demonstrating that it's clearly a global problem requiring a global response. On those 6 continents, there are so many individual stories of people struggling with NTDs. But how many people do you think that equates to? Let me ask. Approximately how many people are currently affected by NTDs around the world? Is it 8.6 million, 1.7 billion, or 2.2 billion? Very shortly, Femi will be chatting to Dr. Mwele Malechela from the WHO. But first, a performance from Kenya's premier spoken word poet. It's the multi-award winning, always compelling Teardrops.
Mahatma Gandhi once said, "The true measure of any society is seen by how it treats its most vulnerable members." I've lived in 2 worlds. I've seen The wonders of the world. I've seen men go to the moon and back. I've seen men building the greatest wall. I've seen men drilling the deepest hole. I've seen men not asking for a cup of water but Wi-Fi passwords. I've seen men finding water on Mars. I've seen it all. So what's the need of men going all the way to Mars to find water and a fellow man on Earth can't find water? I refuse to live in a world where it's easy for an army to disperse protesters with water cannons that have clean water, but it's hard to combat parasites that are living in water. I refuse to just stand and watch diseases with complicated names trying to complicate lives. It's sad to watch diseases that you only read about in theory being practical on bodies of the people that you care about. We can't afford to fail both on our biology exams and also fail in taking care of ourselves. See, where I'm from, our drinking water is not only polluted, it's also electrocuted. And if I tell you how many people die from drinking water, you'll be shocked. I refuse to live in a world where sewer lines, clean water lines, and illegal power lines run concurrently, apparently. I refuse to live in a world where men stay up late to watch 22 people kicking a ball, but there's a million people out there with legs too heavy, with the size of a ball, and nobody's having sleepless night. I refuse to live in a world where we have free waterfalls, but not free water for all. I refuse to live in a world that the water we flush in our toilets are 100 times cleaner than the water that other people are drinking. I refuse to be in a world where the water in swimming pools are getting a much better treatment than the water that our fellow men are drinking. And those are the things that make me sick. A man going without food for 3 days and that without water for 7 days doesn't make someone strong, it makes you weak. I refuse to live in a world where politicians can go to the driest part of the continent to look for votes but not to distribute medicine or information to those that matter the most. If water can make it to the mountain, through rivers, to villages without proper channel, why can't men do that? I refuse to live in a world where creatures that can't be seen growing bigger than Hollywood movies and start creating sin. I refuse to stand and watch water taps running and others can't find water. If water is life, it's so sad. Now it's included in 1,000 ways to die. So when you go to sleep tonight, I want to think about the people with worms that even early birds are afraid to catch. And if faith heals, I think we should create more hospitals in the church.
I want us to think of the neglected people living with neglected tropical diseases.
Dr. Mwele, first of all, introduce yourself to our audience who may not know your work.
So I'm Mwele Malechela. I'm director for the Department of the Control of Neglected Tropical Diseases at the World Health Organization. And we work on 20 diseases, which are diseases of poverty.
What is your drive? What are you and your team doing?
We had a roadmap which started in 2012 and was ending this year, 2020. So our aim was to, with all the successes that we've had great success. We've had 500 million people no longer needing treatment. We've had billions of people, 1 billion treatments for the past four consecutive years, 1 billion people being treated. These are huge numbers, and this is enormous success.
Dr. Mwele, I know your working life is very different right now because of COVID-19. So a lot of your team are working away from the office. But if you roll back 6 months, what would be a typical day for you and your team? What do you spend your time doing?
A lot of our time in the past 6 months, at least, has been focused on completing the roadmap and getting the roadmap, our new roadmap from 2021 to 2030 up and running. So our focus has also been to look at all the diseases within the neglected tropical disease portfolio and not just a few. So to ensure that all the diseases, that these diseases of poverty are addressed in the roadmap. And that has been our focus over the last few months.
We're actually able to visualize this new roadmap. Can you pick out a couple of important milestones so we can see what is happening at the beginning and then what should be happening at the end?
So the key shifts that we are looking at within the roadmap is, first of all, from measuring process to now measuring impact. So what gets measured gets done. So it's really important for us to be looking at impact. And then looking from vertical programming, so there's a shift from vertical programming to a more holistic cross-cutting approach. And this is where we put in water and sanitation. We link the programs to the health system and integrate them into the health system. We have links with mental health, with disability, and other groups which we didn't have as much linkage with as before. And finally, moving from a partner or a donor supported programs to programs that are country owned and country financed. So those are the three major shifts that this roadmap is envisaging. As we move forward, we have looked at what are the major gaps. And some of the major gaps are diagnostics. So we have a major gap in diagnostics, which is stopping us from getting to our goals. So, and then gaps in monitoring and evaluation, because that will allow us to know when we have reached the end and when we have reached elimination or control. And also supply chain and logistics. And all these things, interestingly enough, Femi, are things which are linked to COVID. So, some of these things are, access and logistics are key issues around the COVID pandemic, as well as monitoring and evaluation. So we in terms of building back better, this roadmap has activities and things that really resonate well with the community and with the broader global health community from the perspective of the COVID pandemic. And of course, advocacy and funding is a key area, and strengthening partnerships is also a very key area.
I have seen you use your platform very cunningly. So I've seen you being invited to talk about dengue, for instance, and then you use the platform to talk about the other 19 neglected tropical diseases. That idea of making us aware, even people who are very invested in neglected tropical diseases, you can't have your favorites. It's a little bit like the Sustainable Development Goals. You can't have, I'm just going to do that one with the kids, or I'm just going to do that one with education. You have to do all of them. What is it that you're thinking when people ask you to talk about one? How do you sneakily add in all the others as well?
This thing that binds them together is that they're diseases of poverty and they exacerbate poverty. And so you can talk about, start talking about one and end up talking about the others very easily, because these diseases affect the same people. And in some cases, it's the same, one person can be affected by 2 or 3 or even 4 of these diseases. So it's not very difficult to do. I think many times as experts, our silos are dying for, because when we focus just on our silos, we find ourselves not wanting to go beyond them. And we do a very, very good job in one area, whereas the rest of the neglected diseases start falling short. And I think this is the beauty of this roadmap, is that, it's about looking at all the neglected tropical diseases and finding a way and looking at better integration and in order to move this agenda of elimination, eradication, and control forward.
Let's talk about targets for this new roadmap. Did you write the roadmap, Dr. Mwele?
It was a very consultative operation, if I can say so. All our stakeholders in the neglected tropical disease community. It also involved people in the WASH community, people in the One Health community. So we had a broad range of stakeholders, because we wanted a broad cross-cutting approach to this roadmap. So it was very consultative, and what people will always say, or I guess hopefully remember from this roadmap, is just the amount of consultation that went into it.
I remember the consultation process for the SDGs, and it was a nightmare. Everybody had their favorite thing they wanted to put in. You've got to do this, you've got to do this. And then you have this huge, big framework.
I think the most important thing is to, first of all, agree on what the framework is and what are the areas, mainly what are the areas of agreement. Most of the neglected diseases, they're diseases of poverty, they're diseases where the socioeconomic status is not so good. So water and sanitation is important, et cetera, et cetera. Once you agree on the key frameworks, then it's about setting the broad targets. So the broad targets like 90% reduction in people needing NTD interventions by 2030, that was one of our key targets. And so then you go to the disease-specific targets. And I think the disease-specific targets then focus on each of the diseases, where they want to go and where they need to be by 2023, 2025, and finally 2030.
Do you and your team feel special? Do you feel that you are doing something that the rest of the medical profession isn't doing, that you're shining a light, you're still doing research, you're still working on medical protocols for neglected tropical diseases that people have forgotten, they don't even know about? Does that make you very special as a team?
I wouldn't use the word special, but we feel honored. We feel honored to be working on these diseases, which are diseases of, kind of ancient, diseases which were talked about in the Bible that still are plaguing people today. And unfortunately, they're plaguing people, they're also showing the vast inequities that exist in our nations. And so I think that we as a team feel very honored to be able to continue the work in these diseases, to continue the fight against these diseases, and to just continue to shine a light on these diseases and do something about it.
Dr. Mwele, I'm just thinking of a very pithy way to end this interview. So I want to ask you about powering the partnership, the end of neglect in terms of neglected tropical diseases. But we're talking about powering the roadmap. What is that final thought that you want to leave us with? What is going to be the power behind the roadmap, the new roadmap?
So the power behind the roadmap is togetherness. We are indeed stronger together always. And I think the neglected tropical disease community is a very strong and committed community. So I think having a very strong and committed community, rallying around something that really will give us results and which is broader than just our own community. So it involves us also spreading a little bit outside our comfort zone. I think this is a great opportunity for us to move forward. So yes, I would say we are stronger together.
Dr. Mwele, thank you so much for talking to us. Really appreciate your time.
Thank you very much, Femi. It was wonderful.
That's a great interview, Femi. What brilliant work Dr. Mwele and all her team at WHO are doing, and it's much needed. Over 1.7 billion people around the world are currently affected by NTDs, which, as I'm sure you're aware, is the answer to my previous quiz question. Now, to effectively combat neglected tropical diseases, people need to work together. Global and local innovative partnerships are essential. So, next quiz question. Who do you think said, collaboration between partners across the world has accelerated us closer to the elimination of NTDs than ever before? Was it Bill Gates, Professor Stephen Hawking, or Angela Merkel? Have a think about that. Working in partnership and thinking creatively can help alleviate some of the root causes of NTDs, the improvement of basic water supplies, community provision of an adequate sanitation infrastructure, and improved housing. I spoke to a number of people about how to initiate innovative partnerships to beat NTDs. But first, joining us from Addis Ababa is Her Excellency Amira El-Fadil Mohammed El-Fadil, Commissioner for Social Affairs, African Union. Your Excellency.
Yes. Welcome.
Greetings to you.
Welcome, Henry.
Your Excellency, it's wonderful to hear what you have to say.
Thank you. Honorable ministers, senior government officials, or representatives of international development organizations, ladies and gentlemen, I would like to say at the beginning that all protocol observed, and allow me at the beginning to express my sincere gratitude to the invitation to participate in this very important occasion on NTDs with a very strong theme, power, the partnership, and the neglect. Yeah. I would like also to commend United NTDs for organizing this event amid the COVID-19 pandemic. An affirmation that despite the pandemic, we are still addressing all other health challenges to prevent retrogression of the strides attained. I would like also to congratulate WHO for the development of the roadmap on the neglected tropical diseases 2021-2030. This comes at a time when Africa as a continent is developing a common position to intensely advocate for the control and elimination of NTDs through allocation of increased domestic finances, and resources is always a challenge. Also, we are looking for stakeholder integration, more coordination, more harmonization, and the strengthening of partnership in countries and across the border. And this usually when we develop common African positions, it goes through different stages of consultations. We start with the expert level in our member states. When they do the work, then we take it to the political level. Also, the recent data published by the WHO confirmed that in 2018, people were treated for at least one of the 5 NTDs targeted for control and elimination. This success has been attained for the 3rd consecutive year. I would like here to applaud our member states for taking up ownership of the fight against NTDs, and also partners and various stakeholders for contributing to this success. NTDs are cross-cutting diseases which affect various sectors, including the supply of clean water and sanitation, which is SDG Goal 6, industry and innovation, infrastructure, which is also speaks to SDG Goal 9, reducing poverty and inequality among the population, considering that NTDs are mainly found in the poor and marginalized communities. And this also speaks to SDG Goal 1 and 10. And partnerships with other sectors, SDG Goal 17. As such, control and elimination can only be achieved through the integration and coordination of interventions and activities. Our member states in Africa should ensure adequate engagement and ownership of NTDs programs through decentralization of interventions. Additionally, countries should promote the integration of the communities during the decision-making processes to promote local leadership on those programs. Collaboration of relevant ministries, such as the veterinary, agriculture, water and sanitation, health, education, communication, local government, and between various stakeholders should be reinforced. Esteemed ladies and gentlemen, participants, the African Union Commission has actively advocated for the control and elimination of NTDs over the past 10 years. This was demonstrated during the 6th session of Conference of African Union Ministers of Health in 2013, adopted the Continental Framework for the Control and Elimination of NTDs by the year 2020, this year. More recently, the Commission hosted the first experts meeting on NTDs in March 2020, where the Common African Position on NTDs was developed and the Continental Framework revised to cater for the period 2021-2030. The experts also recommended that the NTDs meeting should be held annually, as it provides an opportunity to recommend the necessary steps required for control and elimination, and also for countries to share best practices and challenges faced. This will accelerate the attainment of the aspirations of the Agenda 2063 for the Africa we want. And this Agenda 2063 is fully aligned with SDG 2030. Ladies and gentlemen, in conclusion, the African Union Commission is committed to attainment of Aspiration 1, Goal 3 of the Agenda 2063, of well-nourished and healthy citizens. Therefore, we will continue to support member states to ensure that NTDs are eliminated from the continent. We will also work with partners to ensure success is realized to that end. I look forward to a fruitful meeting. Thank you for listening, and thank you for having as part of this very important meeting. Thank you.
Commissioner El Fadel speaking on behalf of the African Union Commission. Thank you so much for joining us live from Addis Ababa. Now, Mundo Sano is a family foundation which works in partnership with many public and private institutions. Their president is Dr. Sylvia Gold.
Fundación Mundo Sano is a family foundation founded by my father 25 years ago. We are committed to improve access to health to people affected by neglected tropical diseases. We work in the field, we research with the aim of producing evidence to cooperate with public health policies. Therefore, we believe a lot in public-private cooperation, and we create awareness to make visible these diseases.
Marginalized people around the world are victims of similar types of inequities. Lack of basic resources such as water and sanitation, infrastructure, lack of access to education, lack of access to healthcare. This is the inequity of neglected tropical diseases, and it affects vulnerable people everywhere across the globe. In Mundo Sano, we stand against inequity, fighting it with programs that aim to guarantee the right to education, the right to prevention, and the right to health. When we combat NTDs, we stand for equity, equal opportunity to smile, to prosper, and to achieve well-being. We have achieved much, but there is always more to be done. Mundo Sano, many achievements behind and many challenges ahead.
All Latin America has a big problem of inequity. Really is the region of biggest inequity in the world. So Argentina has people living in very hard conditions. So it's our country, we have endemic diseases, we work in the field. That's where we can learn. Argentina has the advantage of having capacities. People suffering suffer the same all over the world. It's no difference. We have to understand COVID as another disease and think more in universal coverage of health, having more transversal approach to control all the diseases. So living in a world with COVID, with health systems, and with primary health approach.
Sylvia Gold from Mundo Sano, one of an increasing number of family foundations who are becoming stakeholders in this space. It's important to have them. Now, the problems caused by COVID-19 are all too apparent. Why should people invest in NTDs whilst we're facing a global pandemic? To answer that question, the president of the Diet Task Force for the Elimination of NTDs in Japan, the Honorable Mr. Shiozaki Yasuhisa, speaks to us now.
Greetings. I am Yasuhisa Shiozaki, a Japanese parliamentarian. I have served as chairman of the Diet Task Force for eliminating neglected tropical diseases since May of 2019. The 2020 summit, scheduled to take place in the capital of Rwanda, Kigali, on June 25th, was regrettably postponed due to the COVID-19 pandemic. But now, the NGO Uniting to Combat NTDs has stepped up to organize this virtual event. I am sincerely grateful for your efforts. Japan has itself approved or is in the process of developing drugs to treat at least 6 of the 20 neglected tropical diseases. We set up the Global Health Innovative Technology Fund to develop new drugs for NTDs through public-private partnerships. And for the first time, Japan has contributed a total of $2 million across the fiscal of 2019 and 2020 to the expanded special project for the elimination of NTDs, which is responsible for drug delivery in Africa. The Bill and Melinda Gates Foundation has graciously matched our contribution. The important thing is to ensure that treatments are reliably delivered and that we maintain momentum in the fight against NTDs. We intend to firmly support that delivery and continue developing new medicines in order to ensure the necessary treatments reach the places and the individual patients who need them. COVID-19 has swept the globe and is currently raging in areas such as Africa and South America. Some areas in which you have all worked so hard to help eradicate or alleviate poverty might have regressed somewhat, and that concerns us greatly. The Tokyo 2020 Olympic and Paralympic Games were postponed, and we will now host the Games in the summer of 2021. We would love for everyone to come to Tokyo, and we'll do our utmost to ensure the event is free for COVID-19 and from NTDs. Thank you.
Thank you, Shiozaki-san. Looking forward to a healthy Summer Games in Japan 2021. Joining us now from Canada is the Parliamentary Secretary to the Minister of International Development, Kamal Khera. Very good to meet you, Kamal. Here's a question for you.
Thank you for having me.
Thank you very much for being with us. Now, COVID-19 has shed light on and amplified inequalities globally. So, how will Canada plan to ensure that we leave no one behind as we work toward the SDGs in 2030?
Well, thank you for that question. I think if there is hope in all of this, it is in the swell of global solidarity in response to these amplified inequities. Canada's 10-year contribution to support health of women and girls last year could not have been more timely, as we see how women and girls are often bearing the brunt of this COVID-19 crisis. Whether on the front lines of community health services or trying to manage additional obstacles of accessing basic services for themselves or their families, we know that ensuring that no one is left behind begins with understanding the impact on women and girls. That's why Canada's Feminist International Assistance Policy is crucial. We cannot let the important gains that we have made towards sustainable development goals slip through our fingers. To protect gains, to mitigate any losses, and to ensure that everyone is taken care of, we need to make sure that women and girls and all of their diversity are brought to the table to ensure that their priorities and those of their communities are understood and prioritized. Canada is working extremely hard to ensure that all those voices are heard, whether it is in the face of COVID-19 or neglected tropical diseases. Resourcing and delivery of safe water, sanitation, and hygiene and control interventions must be prioritized to accelerate progress towards public health and public development goals for all people, regardless of where they live. And as we increase the support to respond to COVID-19, Canada will certainly continue to support essential health services and sexual reproductive health rights services that we know women and girls and their communities rely on. Maintaining that support, also responding to continue this pandemic is how we're going to ensure that is done.
Kamal, thank you very much indeed. There was, as you know, if you're watching, a bit of distortion on the line, so we missed the second half of what you said, but I think we got the gist of it. And Canada clearly is supporting global efforts to address COVID-19. What we want to make sure is that attention is not diverted from other diseases, particularly the NTDs, as we move towards those SDGs in just 10 years' time. I'm just going to see if we can go back to you and ask you how you're going to try and ensure that while we focus on COVID-19, we don't divert too much attention away from those really important NTDs.
No, and thank you, and I hope that you can hear me fine now. You know, COVID-19 threatens to overpower all health policy and operations planning, and doing so risk eroding the global health gains that we had made, including in efforts to combat neglected tropical diseases. But at the same time, it is demonstrating just how focused we can be globally and how much global solidarity exists. And that ultimately gives me hope. You know, as a former registered nurse, I know that we need to continue to focus on things that we make better, especially when it comes to strengthening our health systems. We must ensure that we remain focused on the progress that we made to date, and we take advantage of the current pandemic to not just build back up, but build back better. And we cannot afford to repurpose all of our efforts and create crisis within a crisis. You know, health systems are straining to respond to this pandemic, but we need to protect comprehensive sexual reproductive health rights is also more important more than ever, but also supporting community health efforts to ensure that practical solutions to real problems like the NTDs are addressed at the local level. We need to ensure that women and girls are able to access the services that they are required, whether it is COVID-19 testing or a comprehensive package to sexual reproductive health rights or treatment and prevention of these neglected tropical diseases. I think more than ever, we need coordination. We need to make sure that we're coordinated to help those affected and protect the health and safety of people around the world. And Canada will certainly continue to support these efforts to strengthen health systems and primary care, especially for the most vulnerable.
Kamal Kira, thank you very much. And I could feel the energy and passion of a former registered nurse coming through everything that you said. And we'll be looking at what Canada does in the coming months and years. And now let's hear from Dr. Maria Flashbach, Parliamentary State Secretary of the German Federal Ministry for Economic Cooperation and Development, as she outlines the BMZ's holistic One Health approach.
Excellencies, honourable ministers, distinguished partners, ladies and gentlemen, 500,000 people die each year from neglected tropical diseases, NTDs. There are 1.5 billion people who suffer from the after effects of NTDs, for example, blindness or other disabilities that affect their ability to work and learn or that cause social stigmatization. These problems often affect the weakest members of society, like women and children, in the world's poorest countries. 40% of them in Africa alone. Various factors negatively encourage NTDs. The loss of ecosystems, the extinction of species and climate change, but also unclean water, malnutrition and poor hygiene standards, and last not least, the ever-increasing proximity between people and animals as a result of the enormous population growth that we have seen over the last 100 years. NTDs, and especially zoonoses, show us just how much our own health depends on the health of our environment and of the animals that live in it. As a veterinary doctor and an advocate for better global health in general, I am very concerned by the coronavirus pandemic. There is, however, some good news. We know what must be done. The only way that we can fight COVID-19 and many NTDs and hopefully prevent them is with a holistic, multisectoral One Health approach. To do that, we must act now, acting a joint multisectoral approach, strengthen the health system in all the world's countries and improve hygiene knowledge and standards. We must improve the protection of animals and the environment, strengthen sustainable food systems, and we must make it possible for all people to have access to clean water. The new BMZ thematic initiative of One Health pandemic prevention ticks all those boxes. The idea behind our One Health initiative is to bring together more efficiently human health, animal health, protecting biodiversity, providing clean water, and the food security as parts of one overall approach in our development cooperation projects. And we have already made a start. Together with the East African community, we have organized the biggest ever field simulation in Africa. The topic was an outbreak of Rift Valley fever. 300 participants through many disciplines and sectors took part, including doctors for human medicine, veterinary doctors, environmental experts, and farmers. Further simulation exercises are planned. Ladies and gentlemen, yes, COVID-19 is shaping our everyday lives. But no, this does not mean that our health issues will fade into the background. I look forward to continuing our work together. We will continue to count on your support.
Dr. Maria Flachsbaus from Germany's BMZ Development Agency. Vielen Dank dafür. Now, collaborative partnerships between countries are essential in combating NTDs, as are collaborative partnerships between the generations.
Good afternoon, everyone. My name is Gerald Chirinda. First of all, I'd like to thank those who attended our Power the Youth event. I hope you found it as fulfilling and energizing as I did. Now, Youth Combating NTDs was born out of a personal commitment that I made in 2017.
I like to look at myself as a seed, and a seed by its very nature multiplies. And it multiplies according to its own kind. So ladies and gentlemen, expect this seed to multiply and expect this cause to sprout up amongst young people in different parts of Africa, thereby raising up more NTD champions.
And I'm happy to inform you all today that with the support of Uniting to Combat NTDs, we have been able to build a global youth movement on NTDs. And here are some of our milestones. Hundreds of youth representing several countries came together and signed what's called the Dar es Salaam Youth Declaration on NTDs in Tanzania earlier this year. Secondly, as a youth-led initiative, we have recently selected a youth advisory board, which comprises of 13 incredible young people from all over the world. We also have a growing champions community that currently stands at just over 800 champions. Last but not least, we have managed to engage the World Health Organization during the NTD roadmap consultations. And this engagement led to the roadmap now including a statement on the importance of youth in the fight against NTDs.
So you give me a great challenge to ensure that we actually put in a statement on youth in the roadmap. And I'm very happy to leave here and go and do that.
So that is a commitment. Thank you very much, Dr. Mwele. And we're just getting started. We hope that over the next 10 years, we will work closely with you in the fight against NTDs. As I close, I would like to leave you with two questions. Number one, what does youth mainstreaming in your organization look like? And the second one, how have you partnered with young people in the fight against NTDs? Well, the youth are here to complement and to partner with you in this fight. And if you would like help answering and exploring those two questions, please don't hesitate to reach out to us. We believe that this is a generational fight, and we are so privileged to be standing on the shoulders of giants such as yourselves who have gone before us. Thank you for being such incredible torchbearers, and thank you for rallying behind the NTD-free generation.
Great stuff, Gerald. Thank you very much for your youthful and energetic leadership. Now, innovative partnerships are clearly the key to combating NTDs. Our last quiz question was, who said collaboration between partners across the world has accelerated us closer to the elimination of NTDs than ever before? The correct answer, I'm sure you knew, was Professor Stephen Hawking. But clearly it's a sentiment shared across the board. So I've got another question for you. Which NTD has no medicine or vaccine and yet is on the verge of eradication? Is it A, sleeping sickness, B, guinea worm disease, or C, leprosy? And here's a clue. Its worldwide demise has been achieved mainly through community-based programs, and 95% reduction since 2000 is due to partnerships and collaborations. But I'm sure Femi Oke knew that already, didn't you, Femi?
I have all the answers here. Do you know, it's interesting, in the last hour, Henry, we had Dr. Julie Jacobson,
Yep.
and we also had Dr. Maria Rebello, and they were basically doing a Ask Us Anything, and we got so much reaction from that little Q&A section. I wanted to just do a little shout out to people who were there watching online, who are out there watching online. Thank you for joining us. So Dr. Maria's point on the key importance of data in winning this fight, and Dr. Julie's emphasis on trust as a key asset of NTD programs are both so on target. That was Catherine Sanchez. She really appreciated the two doctors. Great to see Maria and Julie. These are amazing women who never give up the fight against NTDs. Chelsea Toledo, thank you, Chelsea, for watching. Really appreciate that. One more. I'm sure that Dr. Julie and Dr. Maria's heads will be so big, they wouldn't even be able to fit on our event screen right now. But one more compliment from them. So many formidably talented and passionate women leading the charge against NTDs, and that's from Sarah, Virginia. Thank you so much. Thank you for watching. Thank you for following. You know, you've got your chat box there, so you can network on the chat box online, and then also you can ask questions as we have our various guests coming on. So, what should we do now? Well, back at the London Declaration on NTDs, that was in 2012, there were some founding partners, and we wanted to check back in with them to see where their commitment actually is. We're going to start with an organisation I know you know really well, connected to the UK government, and that is DFID. I want to bring into our conversation Minister Wendy Morton. Hello there, Minister. How are you?
I'm very well, thank you, Femi.
So, Minister, you have a very long title. It's got slightly longer in the last couple of weeks or so. Can you tell everybody who you are and that title that you hold? Because your portfolio is perfect as far as NTDs eradication is concerned.
Thank you. Yes, I do have a long title, or you could call it a job description. So I am Parliamentary Under Secretary of State at the Foreign and Commonwealth Office, but also at the Department for International Development. And at the Department for International Development, my portfolio includes global health. So I'm absolutely delighted to be here with you today.
Thank you for coming. So, Minister, what did you want to say initially? I mean, setting the scene, setting out the table. This has been an 8-year partnership with DFID that worked out really, really well. Your thoughts today, what are they?
Sure. Well, first of all, let me thank you, Femi, for the very kind invitation, and to the Coalition for inviting me along and to be able to say a few words. If I'm honest, I wish we could have all been together in person at the summit in Kigali, but I'm very happy to see that so many are here involved in this summit, albeit virtually. So many who have dedicated so much to tackling neglected tropical diseases. And what I wanted to focus on, first of all, was just some of the achievements that we have seen today. So 8 years on from the London Declaration on NTDs, we can be really proud of what we've achieved. Collectively, our work has improved the lives of some of the world's most vulnerable people. There are some fantastic milestones, over 1 billion treatments for NTDs in 1 year, more and more accurate mapping and to improve targeting, and hundreds of millions of people who are no longer at risk, so that map shrinks. But you know, much of this work is down to, so this progress is down to the work of partnerships that were established then and that are represented here today. I'm also really pleased to see that UK investment is really delivering tangible results. In the last 3 years, our programmes have supported treatment or care for over 160 million people. We've distributed billions of pounds of medicines generously donated by the pharmaceutical companies who are also here today. And this has prevented the devastating effects of these diseases on families' livelihoods and on children's school attendance too. It's helping to protect so many future livelihoods. But what's even better is some of these confident and adaptable programmes have made real contributions to the COVID-19 pandemic response. Our NTD programmes are a vital part of the UK's global health work, and all people should have access to quality health services without the risk of financial hardship. We've been talking about how NTD programmes support this goal of universal health coverage. We're tackling and targeting causes of death and disability amongst the world's poorest and integrating with other essential health services. As an active partner in the World Health Organization's roadmap to 2030, it's fantastic to see that focus on resilient and sustainable health systems. I'm incredibly grateful for that leadership, but also for the leadership of Dr. Malasela and her team. There's no two ways about it, Femi. This is a difficult year, but it's amazing that the strength of our partnerships keeps shining through. We continue to make progress, but what's even more amazing is the networks of health workers built into our NTD programs and the way in which they are supporting the COVID-19 response. So let's keep up the push, and as partners, let's continue to work to end the pandemic of NTDs by 2030. Thank you.
Minister, thank you so much for those really thoughtful idea of where we are right now. And you said yourself it's a difficult year for so many reasons. It'd be really nice if we could just go zoom past 2020 and then go on to 2021. But this idea about long-term commitment and long-term partners, it's always that point in a relationship is, are we going out? Are we going to get married? Is this going to go on for the next 10 years? I always feel like that's what the second roadmap is like. How do we know? Because there's so much turmoil right now in terms of donors, in terms of governments, in terms of reorganization. How do we know that there's that commitment from you as a founding partner going all the way to 2030?
You raise a really, really important point. And NTD programs have been a brilliant example in reaching the most remote and marginalized communities in the world. And we've seen how, how networks of community health workers and volunteers built by NTD programs are contributing to the COVID-19 response. We all share the concern that the impacts of COVID-19 will slow progress towards our goals on NTDs. But we've seen incredible results that we must protect, such as the recent elimination of LF by Malawi. And at this challenging time, we really must build upon the strengths of NTD programs to continue to deliver prevention and care. I know that Partnership is already actively planning to safely deliver services in creative ways to continue despite the challenges presented by COVID-19. And it's by integrating our efforts with other disease programs and with health systems that we can achieve even more. And this is why while delivering NTD services now, our program is also investing in health systems strengthening alongside others in this partnership. And in doing so, we support the ambition of the upcoming NTDs roadmap to 2030 for sustainable progress on NTDs that was discussed earlier today. The UK is proud to be part of this partnership and to continue to work together to tackle NTDs.
Thank you so much, Minister Morton. I know you're going to be spending some time on our site. You're going to be watching the rest of our virtual event, and we really appreciate you sticking around. Thank you very much. Take care. So we go from the UK to the US agency. Emily Wainwright is a senior NTD advisor at the US Agency for International Development. Emily, hello there. How are you?
I'm good.
What's the most important part of your job, Emily?
Wow, that's a really good question. The most important part of my job is making sure that the resources we have been given through the US Congress can be spent as effectively and efficiently in as many countries as possible so that we can achieve the goals of controlling and eliminating these terrible diseases.
You've had so much success in eliminating diseases. Do you want to do a little bit of a humble brag and explain what you've done over the years?
I don't know if humble brag is the right way to for us to think about it, because it really has been an amazing partnership. We started out 14 years ago with about $15 million and worked with 5 countries, and we were kind of hoping that we would be able to treat people in some way or form at scale. And the idea of eliminating diseases was really aspirational. So here we are 14 years later, and we've been able to spend almost $1 billion across 30 countries. And in those 30 countries, working with them and the pharmaceutical companies, we've been able to provide 2.8 billion treatments, and that's leveraged about $26 billion in donated drug. And I think the real amazing thing is the aspiration of disease elimination has come true. And 10 of those countries that we've worked with have actually eliminated at least one NTD. So it just really shows that this works.
I mean, the US is the biggest donor for NTDs globally. Does that feel like a lot of responsibility there? Do you feel that you have to lead the way, regardless of what is going on in terms of the administration, where you are, what politics is, COVID-19? You still have to be out there.
I think that's true. And one of the great things about the group that I work with, it's such a passionate group about this agenda, and we're so honored to actually be able to work with the governments and the people with us that I feel like that's the flag we wave every day when we wake up, to make sure that, you know, this mission doesn't get lost, and to have the opportunity to actually improve the quality of people's lives globally it's a real privilege that we don't take for granted.
Plans for NTDs and future projects, briefly, Emily?
So tons of cool stuff coming down the pipe, but I would say there are three things that we're really focused on. Despite the COVID situation that's going on, in the next 3 to 5 years, there are about 15 countries that we're working with that are on track to eliminate at least one NTD. And we're full court press focused on working with them to get that done. The investment's been made. We need to see it realized and just make that difference in people's lives. The second thing, as Dr. Moyle raised earlier, really looking at this whole sustainability conversation as a development agency. That's the sort of thing we like to focus on. And right now we're working with 10 countries to look at what are their strategies for making sure their NTD programs are sustainable, so you can get the public health benefit from that, but also make sure that NTDs support all the other sectors that they contribute to. And then the third thing we're really excited about is, and we announced last November, is we have a new $5 million investment in diagnostics, and we're looking at getting that launched and off the ground.
Emily Wainwright, thank you so much. Really appreciate your time today.
Great, thank you.
There are pharmaceutical companies who actually donate drugs, medicine, to actually help with treating NTDs, eradicating NTDs. I want to introduce you to a drug company known as SI, and they've been doing amazing work uniting to combat NTDs. And I'm going to look up just the word here to make sure I say it right: lymphatic filariasis. You will find out more when you check out this video. Thank you, SI, for your partnership. Within this hour, we're looking at powering the partnership, ending the neglect, going back to some of the original founding partners of the London Declaration as we look ahead to 2030 and a new roadmap. Thomas Quenny, nice to see you. Welcome. How are you? Tell everybody who you are and what you do. You are one man, but you represent so many.
Thank you very much, Femi. Very pleased to be with you. I'm the Director General of IFPMA. We are the Global Association of Innovative Pharmaceutical Companies and Trade Association, and we are one of the partners of the London Declaration. We are partnering with WHO, and we are based in Geneva.
So good to have you. This idea of so much was achieved in the first 8 years with the first roadmap, and now the next one takes us to 2030. How much does a roadmap help you? How much does all the stakeholders coming together and agreeing these are our milestones as representing the companies who are going to be providing medicine? What does that do for you?
It's really an important step. I think it's a game changer, and we very much welcome the roadmap from WHO because it does indicate the importance of endemic countries. It does indicate that this is not something where you have some patronizing people from Geneva or companies telling countries what you do, but it really emphasizes the importance of ownership by countries. Ownership means deciding themselves the agenda, committing resources, including financial resources, to combating NTDs. And this also drawing on what we as the industry bring to the table, namely the expertise, our competence in researching, developing and manufacturing and deploying medicines which help to combat NTDs.
Thomas Quenny, it's so good to have you. Thank you so much for joining us today. Really appreciate you.
Thank you very much, Femi.
You're very welcome. So do you remember the London Declaration? NGOs, governments, donors, countries that needed to have eradication happening. So many people all together, or so many stakeholders in that mix, NGOs. Let me just say hello to Yobi Zhang. Yobi, hi.
Hi, Femi.
Hi, Yobi, from the NNN NGO network. It feels like there's an acronym in an acronym there. Do you want to tell everybody who you represent, who you are, so they actually understand what we're about to talk about?
Thank you, Femi. I'm the Senior Scientific Advisor for NTDs at Helen Keller International, and I'm also the chair of the NTD NGO network, which is a global network of about 90 NGOs working to combat NTDs.
What I was just going to ask you about what the NGOs can do in terms of a roadmap and eradicating, eliminating, controlling NTDs. What do you think your power is?
The NGOs really play a very important role because of our NTD program experience for decades. For the last decade, the NNN has served as a global forum for NGOs, and we work together to develop and share and implement best practices to support endemic countries. And NNA is actually the community of practice for NGOs to support prevention, treatment, and management of NTDs. So this has led to several achievements, such as the WHO NNN WASH NTD Toolkit launched in 2019, and also the recent stigma guide in this month by iLab and NNN.
With the previous roadmap, there was still work to be done. Do you feel that this roadmap was going to keep everybody on track, that come 2030, we're just going to have a huge party?
Yes. So the new roadmap, NNN, NGOs really support the paradigm shift. And since the last roadmap, I think NNN has evolved from the disease-centered forum to one that addresses the NTDs holistically. And NNN has the best framework really launched in 2016 includes, the behavior change and environmental measures, the social inclusion and treatment and care. So this framework sets out the NGO's commitments to new partnership across the sectors and also support the country ownership. Absolutely, we will celebrate.
Yeah, Bizang, thank you for being part of the power in the partnership to end the neglect of NTDs. Appreciate you today. Thank you very much indeed.
Thank you very much.
You're very welcome. Dr. Katie Owen is the director of the NTD department at the Bill and Melinda Gates Foundation, and they are making sure that we do not take our eye off the ball, even though we have COVID-19, a global pandemic, to also take care of. Dr. Katie Owen, over to you.
Thank you, Femi. And thank you to all of the speakers and everyone here for tuning in to support the fight against NTDs. The Gates Foundation's mission is to ensure everyone has an equal chance at a healthy and productive life. Few issues embody that mission more than NTDs. Amid COVID-19, the Foundation remains as committed as ever to a world where no one suffers from these devastating neglected diseases. It's true, COVID has set NTD programs back. It also presents an opportunity, a moment to pause, reflect, and think differently. We need to optimize programs to make up for lost ground. We can embrace integration with other health issues, a key tenet of the WHO roadmap. And we must invest in new solutions to speed up progress. In the fight against schistosomiasis, the progress in vaccine development is vitally important if we want to reach elimination. We can't do any of this without carefully measuring where we are succeeding and where we are falling short. Whether it's mapping to ensure we're screening everyone at risk for HAT in the DRC, or developing new post-elimination surveillance systems for LF in India, careful attention to critical data helps us carve a better path to our goals. People often ask me what sets the NTD community apart. My answer, partnership. Look no further than this virtual room. You'll see endemic countries, international health organizations, local civil society organizations, donor agencies, the pharmaceutical industry, and private philanthropy. Each brings steadfast commitment and unique capabilities to tackle NTDs better and faster. We strongly support countries leading the way, as envisioned by the WHO 2030 roadmap, with support from regional initiatives like ESPN at WHO Afro. Other great philanthropies like SIF, ELMA, GiveWell, Virgin Unite, and the Abu Dhabi Crown Prince Court also support NTD elimination. I also want to thank our private sector partners for their commitments, from donating more than 10 billion NTD treatments to fostering innovative partnerships and strengthening supply chains. And I'd be remiss if I didn't mention the important contributions from bilateral donors, especially the United States and the United Kingdom. 10 years from now, we want to be celebrating the achievements of the NTD 2030 roadmap. To get there, we all, private philanthropy included, need to recommit to do everything in our power to work together to fight NTDs, no matter the circumstances. The Gates Foundation is privileged to join you in the fight ahead. Back to you, Femi.
Thank you, Dr. Katie. Really appreciate you. Next, as we're powering the partnership, ending the neglect, some of our really important partners, you're all important, but we have some very important people coming up today. And Mona Hamani. Hi, Mona, nice to see you.
Hi, Femi. It's a pleasure to meet you. Thank you for having me.
Great to have you. Can you tell everybody your official title and what you actually do?
Yes, I'm a senior director at the Abu Dhabi Crown Prince Court, which Dr. Katie Owen has just mentioned, as we are one of the donors that have been supporting neglected tropical diseases. And so one of the many things I do is manage the global health portfolio. Within that, NTDs is a 1781.
All right, so I'm not hearing every single word, but I'm getting the gist of what you're saying just because of our connection right now. Sorry about that, Mona. So as the chair of Uniting, what is the plan for NTDs? What's your next plan and how does the roadmap help you?
Thank you so much, Femi. I mean, what we've learned is that the London Declaration is a major milestone, of which it inspired the creation of Uniting. Since then, we've had over 100 organizations that are part of this. The partnership is a partnership of industry that has given over 12 billion treatments. It's a partnership of academia and research that continue to innovate. It's a partnership of donors. And given all this, I'm super excited to be part of this partnership. As Uniting, And as a board, we have made that our next plan is to expand this partnership, continue to grow it and strengthen it, but also to support the roadmap by the WHO. That means that we need to strengthen our collaboration, expand our partnerships, create more innovations, and create definitely a stronger commitment to the countries that we serve. Collaboration is our best strategy, and as such, we would continue to bring in with us new partnership as part of Uniting.
In terms of what you've seen today, Mona, does that give you hope that this is possible? Because we fell short of the first roadmap. So much was done. Over 1 billion people helped. Amazing work was done. But we had such an ambitious roadmap. What are your feeling about the next 10 years?
I'm personally very, very optimistic. I mean, we've seen the power of the collaboration. We've seen it very strongly. But more importantly, I think what the roadmap has brought is an apparent breaking of silos, emphasizing the importance of collaboration across sectors, emphasizing the need for UHC, emphasizing the needs of healthcare system strengthening. All of these things are super important. It makes me extremely hopeful. I mean, we as Uniting have made a monumentous decision actually right now to shift from our focus, the previous focus on only 10 of our NTDs to have all 20. That is a testament for the importance of not leaving anybody behind, but also to remind us that NTDs are not just diseases, neglected diseases, they're diseases of neglected people, and we need not leave anyone behind. So I think I'm extremely hopeful for that. I'm extremely hopeful about the role that Uniting can play in that, but also the roadmap gives me so much hope going forward.
Your experience as a partner, how would you encourage others to also become partners for NTDs?
I mean, I think particularly with COVID, I'm reminded how important it is to commit to NTDs. You're only strong as your weakest link. And NTDs actually are diseases of the poor. And so it affects the most vulnerable. And NTDs gives us an opportunity to strengthen healthcare systems, to remind ourselves of the importance of that, and would help us actually be, much more resilient in fighting things like COVID and other pandemics that come through. So we as a partner continue to be super committed, but also invite others to be part of that.
Mona Hamad, thank you so much. We really appreciate you. Thank you for being part of our event today.
Thank you so much, Femi.
You're so welcome. We move on to the Children's Investment Fund Foundation. They have committed to NTDs in a very practical way. They have put a director on the African continent, and that new director is Nebiyu Negusu. Here he is.
At the Children's Investment Fund Foundation, we are working on several large investments that aim to eliminate and eradicate NTDs. By doing so, we focus on the poor, neglected population living in tropical areas with the least access to health care, safe water, and sanitation. When NTDs first gained global attention in 2012, we joined forces with government, donors, pharmaceutical companies, to sign the London Declaration on NTDs to control, eliminate, and eradicate priority NTDs. This year, on January 30, 2020, together with the global community, we commemorated and highlighted achievements during the landmark World NTD Day, a first of its kind. While the world is facing the unprecedented COVID-19 pandemic, our commitment is steadfast towards achieving elimination and eradication of NTDs in Africa and India. Currently, we have an ambitious $120 million program of active investment on trachoma, guinea worm, schisto, STH, and WASH. This investment benefit increased country leadership and ownership, cross-sector collaboration between the health and the WASH sector, and technology and innovative business models supporting long-term sustainability. Now is the time to say enough is enough to NTDs by bringing innovative technologies and integrated transformational ideas that will enable us to achieve elimination and eradication on the way to achieve the Sustainable Development Goals by 2030. Together, we can beat NTDs.
Thank you, Nebiyu. Good luck with your job. We go now to Catherine Uhura. Catherine is the Global Health Innovative Technology Fund, and you're going to come and talk to us about innovation and technology. Hi there, Catherine. How are you?
Hi, good. Thank you. How are you?
Very well, thank you. Good to see you. What is it that you can do that other partners are saying, oh, I'm so glad Catherine's there. She's going to handle this part of the roadmap. Explain.
Thank you. So I'm actually wearing two hats today. Calling in actually from Tokyo, Japan. It's quite late here, but it's okay. I'm playing the role of the CEO of the GHIT Fund, the Global Health Innovative Technology Fund that you just mentioned. However, I'm also representing the Uniting Efforts, which is a global platform composed of three parties. One, the government of Japan. Two, the UNDP-led Access and Delivery Partnerships, or ADP. And finally, us, the GHIT Fund from Japan as well. So composed of these three partnerships, which is quite appropriate, right? Because we are talking about partnerships and how to end neglect and NTDs. So this is our partnership that we currently have, and what we're doing in terms of tackling NTDs, in terms of the roadmap and supporting the roadmap as well, is two things that I can think of right now. So due to the COVID-19 impact, two things are happening. One, the NTD service interruption, actually, that we're seeing in countries that which need it most. So that's a critical factor that's going on right now due to COVID-19. The second point is the finance piece, right? So the changed funding landscape that could really result in reprioritization of funds, kind of taking away the funds from the neglected diseases, which is a huge issue. So let me just tackle on the second item further. So in Uniting Efforts, incidentally, so this is from last year, even before the pandemic started happening, we started talking about this innovative financing and how financing is critical in terms of combating NTDs. So we've commissioned several discussions, workshops, meetings really with all stakeholders, global stakeholders coming together, and literally bringing them together in partnership to create this knowledge products or guidelines, if you would, that anyone could use once published. So for example, in the local markets, in the local areas, doctors can use this, hospitals, governments, local government can use it, philanthropy organizations can use it, pharmaceutical companies, access and delivery organizations, any organizations can use these products or knowledge products or guidelines to follow suit and say, okay, how can we really come up with this creative or innovative financing methodology as an example? So as a product, if you would, Uniting Efforts is having these knowledge products or guidelines. Three of them coming up are being discussed, which is also going to be rolled out next week. We're having a webinar on July 2nd. So please visit our website and Uniting Efforts website, which would have the detailed information of this, because if you can really join this, it'll be really useful for you to really see what the innovative financing methodologies could be and how you can utilize these to combat NTDs. And I can't emphasize enough the power of partnership. I completely agree with this title of the meeting, because together we can achieve this. So that truly, I truly believe.
And this idea behind the power of partnership, because we're not only just recognizing some of the founding partners, current partners, but also looking to expand the partnership. What would you say? What would be the elevator pitch, Catherine?
Yeah, so as I mentioned earlier, I think together is the key word. And it's not just a matter of across industries, across countries, it's literally everyone impacted and impacting needs to come together to achieve this NTD roadmap and to really tackle and end the neglect and end the NTDs. So that truly is what I truly believe and I see happening. For example, today, this meeting all throughout, I think we've been hearing partnership, collaboration, all of that is the trend that we're hearing, and it truly does matter. And that's really the only way I think that we can achieve this.
Catherine Ohura, thank you for your leadership. Thank you for your partnership as well. And thank you for staying up late because you are in Japan and it's already nighttime there. We really appreciate you. Thank you.
Thank you very much. Thanks for having us.
You're so welcome. Henry.
Femi, thank you very much. Got to say, I mean, the range of speakers that you've had over the past half hour or so, it really could just highlight, and I hope people are getting this, watching on their screens around the world, the range of different stakeholders and actors who have to come together to power this partnership. You know, traditional government agencies, pharmaceuticals companies, family foundations, investment funds like SIF. Really, really important, and it's only through that collaboration that we can get to the goal that we want to, ending these NTDs certainly by 2030 if we can. So Femi, thank you very much for the moment. As many of you may know, we were all, me, Femi, and so many people included, supposed to be in Kigali, Rwanda, beautiful Kigali today. That day will soon come. But to tell us more, here's the Executive Secretary, Government of Rwanda, Dr. Patrick Dimubanzi.
Your Excellencies, Honorable Ministers, distinguished partners, ladies and gentlemen, greetings from Rwanda. Today, we were hoping to be gathered in our nation's capital, Kigali, hosting the first ever global summit on malaria and neglected tropical diseases. COVID-19 stopped all of that in its tracks, but it has not stopped the needs of more than 1.7 billion people whose lives are so profoundly affected by NTDs. COVID-19 has demonstrated the importance of global solidarity in tackling infectious diseases, the importance of strong country leadership in dealing with infectious diseases. It has also shown us that we are all in this together, that no one should be left behind. This is why Rwanda is proud to play its part as the global host for the first ever Global Summit on Malaria and NTDs, and we look forward to welcoming you. We will win the battle against COVID-19. We will beat neglected tropical diseases. See you soon in Kigali.
Dr. Patrick Dimubanzi, on behalf of the government of Rwanda, who is supposed to be our host in Kigali today, but as I said, at some point we'll get there. Now, my last quiz question was, which NTD has no medicine or vaccine and yet is on the verge of eradication? It's guinea worm disease, which, as I said earlier, thanks to partnership and collaboration, is now almost eradicated. My dad used to say, Vamusa, it's gone, almost gone. Now, as opposed to a question, I'd like to finish on a poll, which we'll leave up for a while. The poll question is, having watched this broadcast, has your knowledge of NTDs increased a little, quite a bit, or hugely? Femi, I know your answer.
Oh, always huge. Got to be huge. Take that poll. You can find it on the website. And one of the questions that we got from the website a little bit earlier, and I saved it towards the end, is from Tamaiko Titus. Tamaiko, thank you for following. Tamaiko asks, what is the role I can play after this conference? So glad you asked. Here are some of our most recognizable supporters with a call to action to Tamaiko and everybody who's been watching. Take a look.
Hello, and thank you so much for joining today's conversation.
This is such an important moment in the fight against neglected tropical diseases, and I'm so glad you could join us all today to celebrate the success and look forward to the future.
You've all done so much already, but united together, I know that over the next 10 years, we can achieve so much more.
Before we end today's event, there's just one more thing that I'd like everyone watching this to do. Ending the neglect of NTDs requires global action and global effort.
And that's why I'd like all of us to unite our voices today and call attention to the 1.5 billion people around the world still suffering from these diseases.
Please join me, and let's all do this together.
There should be a link on your screen in chat. So,
just click on that link now.
Done it? Good.
And there's a tweet there. It's all ready to go. It says,
Today I am proud to join Combat NTDs campaign to end the neglect of neglected tropical diseases. Over 1.7 billion people around the world are affected by these diseases, which disable, disfigure, and can be fatal. Join me to end the neglect of NTDs.
There we go. We've done it. Thank you. Thank you so much.
A huge thank you to Dame Helen Mirren, to Brian Cox, Alice Eve. We're so grateful for you being able to join us. So you've been watching the broadcast today, and I wanted to bring in some of the other comments that people have been commenting on. Hello, Gloria. She wants to know about communication and raising awareness. You know the website now, Gloria, you can find out there. You're making connections as well. And from Wim van Brakel, I've not heard anyone stress the importance of addressing the mental health of persons affected by NTDs. There's only so much we can get into 2 hours, but you're absolutely right, Wim. And we will be doing that, talking about that in the 10 years that we are spreading out our roadmap right up to 2030. Thank you so much for watching. Thank you so much for being part of this broadcast. To my co-host, Henry Bonsu. And I'm going to leave you with one person who's incredibly important. There is no I in team, but a team always needs a leader. And so this is the Director of Uniting to Combat Neglected Tropical Diseases. I will leave you with Toko Elthwick Pooley.
Wow, what a fantastic afternoon. From the amazing high energy youth combating NTDs that opened up our virtual event with the energy, the power, the passion of young people, all coming in and joining their voices to fight neglected tropical diseases. Thank you, youth combating NTDs. To the Power the Partnership event just now, that was great. We had speakers from all over the world, all lending their voices and standing up to be counted alongside the 1.7 billion people who continue to be affected by NTDs. Thank you to all of our speakers. To the World Health Organization, thank you for your leadership, for providing the roadmap with a very clear path on the road towards 2030. We stand fully behind the roadmap and will use our energy as a partnership to support its delivery. To the wider London Declaration and Uniting to Combat NTDs partnership of over 100 strong organizations, thank you for being part of this wonderful community. To the Uniting Secretariat team, thank you so much for your energy and for working so hard to deliver an excellent event this afternoon. Our moderators, Femi, Henry, Loiso, you added something truly special to our afternoon. Thank you very much. Teardrops, what can I say? You were fabulous. Thank you very much. Today's event is a powerful reminder of community. It's a reminder of what can be truly achieved when we come together towards a common cause. The work doesn't end here. You've already shown what can be achieved by taking action. We've been seeing all the amazing tweets in the last few minutes. They are excellent. Keep the work going. Let's keep this energy going on the road to 2030. Together, we can end the neglect. We can beat NTDs.